Okay, thank you very much. Thank you for coming here. Harnessing transdisciplinary approach for diversity, inclusive disaster recovery, and risk reduction. Okay, so this is organized by Asia Civil Engineering Coordination Council Technical Committee, TDF for Building Societal Resilience to Disasters. So I would briefly explain what's a Technical Committee 21. So we are civil engineers. And what we are doing is conducting some research and discussion with experts like this session and producing some papers. So far, what we found, such a transdisciplinary approach is quite important, and experts from diverse fields, we can innovate solutions, and we can respond to various needs. This is our findings. So today, what we will discuss. So diversity and inclusivity and recovery. So why we intended to organize this session? We are civil engineers, and I think civil engineer is a major player for disaster risk reduction. Including me, we love to construct something. And yeah, we are always engaging some reconstruction works once something damaged. However, of course, there are many other issues, and we cannot resolve everything. Furthermore, if we domain some resources, like funding or people or institution during disaster time, it may adversely affect on other areas, like gender issue or nursing, health, etc., etc. So that's why today we'd like to discuss other disciplines experts. Yeah, we have nursing experts and gender experts. Thank you so much for attending. So this is just our concept, so transdisciplinary approach. We believe such academia, civil society organization, or public sector and private sector, we should work together to reduce disaster risks. Okay, so this is just my introduction. And my name is Mikio Ishiwatari, University of Tokyo. And today we have three panelists. I'm sorry, first, Congressman Momo. He cannot join today. He had to attend the president in his constitution, sorry for. And the first speaker is Professor Sakiko Kambara, Kobe City College of Nursing. Second speaker is Diana Alango, sorry for, Senior Gender-Based Violence and Social Development Specialist. And third speaker is Mr. Muhammad Lakmanuel Chakim, Senior Manager of Jasa Tirta Public Corporation in Indonesia. Okay, so first we'd like to invite Professor Kambara Sensei, よろしくお願いします。
Good afternoon, everyone. Yeah, my name is Sakiko Kambara from Kobe City College of Nursing. Today, I'd like to talk about my one story about becoming a nurse and disaster recovery and disaster risk reduction. And yes, this is my profile. I was born in Okayama, Furodo area, but after that, Hanshin-Awaji earthquake occurred. Anyway, I become a nurse and contribute to the RR. So why I can do transdisciplinary approach? because maybe I work for the RR as a civic, just global citizen. I'm not nurse and scientist and one citizen, so I can work, I thought. Yeah, at the time of Hanshin Aoji earthquake, I was a student, and at the recovery phase, I studied there in Kobe, and part-time job in Kobe, work as a volunteer, especially in temporary house and church. And no, I don't have the nursing knowledge, and also I don't know what is disaster recovery and disaster risk reduction. Then I realized, oh, this is disaster risk reduction, I thought. But then I learned nursing, and I realized, oh, this is nursing, and I learned nurse, also the nursing area, no disaster nursing beforehand. So far, but the Florence Nightingale and many nurses and every nurse work in front of as a frontliner of disaster setting, and they work very hard with community and survival. But no report and no research, no academic institute for disaster nursing. So, and then in Japan, disaster nursing academia and the practitioner and nursing academia developed the Society of Disaster Nursing, 1998. Then, so definition of disaster nursing just like that. Already they define the disaster nursing involves the systematic and adaptable application of nursing knowledge and skill for disaster risk reduction. And that emphasizes collaborate interdisciplinary approach at that time. And I also launched the EpiNurse, that because I feel the limitation of as academia. Now, only research, I cannot, I don't know nothing. So I launched EpiNurse for work as NGO, like a non-governmental, non-academic global citizen volunteer for not only earthquake, but also future and unexpected disaster. Yeah, then from a nursing perspective, disaster risk reduction like this. Yeah, all of you know about the risk formula, but for us, anyway, all hazard, multi-hazard already, yeah, and escape from any hazard, and protect survival and life, and maintain health, especially for all vulnerable people. And we should rebuild the living environment, especially for wash issue, and human based on human basic needs. And so, as a result, the nursing action become like a first aid, mental health, or secure food, toilet, bath. Yes, and transdisciplinary nursing on disaster risk reduction, because we need map and technology to adapt to community recovery and disaster risk reduction. So we should learn not only adapt, but co-create the technology also. So I need collaborative work is required. So now work not only as nurse, but work for nurse and work with nurse something. Yeah, this is one example, the collaborative research and transdisciplinary approach with disaster risk management section and cross-sector management. Yeah, because only nurse, if no nurse in the hospital, we cannot meet the community people. Then, yeah, actually when at first when I go to the hospital, they have no casualty because no survivor. So, but that's not correct. So I go to, of course, mobile clinic. Yeah, we can find out only symptom. So when I go to shelter, yeah, I know we can meet anyway survivor. They have already many vulnerability and many they own living life. So now this is we cannot diagnose, but they have life. So how we can care and when and how to know. So we have to think about that. And beforehand, we need that map like this. Yeah, if we at the time of Nepal Golkak earthquake, we can use smartphone. And smartphone, and we realize every people, almost people, yeah, not connected, even though not connected to broadband, but they know, they have a map. They have a map, but use only for, at the time, only for the calling. But anyway, we can communicate with them. And later, at the time, because 2G or not 3G, 2G or not connected. So based on the and adopt the technology and just take some picture and send, go to school using broadband and send to Kathmandu, and we can compare. What is this? The differences? Yeah, only Kathmandu they have shelter and many facility and many inequity we can visualize. And yeah, this kind of work, and yeah, we need the data and the technology to our action. Yeah, then, yeah, on the other hand, at the same time, the relief of the Golkak earthquake 2018, yeah, flood in Western Japan. In fact, at the time, I'm on maternity leave, so I live in maybe this flood area, but just come back from AMDRR in Mongolia, Ulaanbaatar, because my maternity leave, I suddenly have to go back to Japan and maybe spend that time with my baby. On the other hand, but I have to work as a community when I go to shelter. Many old friends and many my friends and people stay there, and I realize if I'm relief first, even though first responder, I didn't know the daytime and nighttime very different the situation. Only first responder can go just after disaster. So and who is community? Where is community? I didn't know, but I know because I'm in my hometown. I can meet the community, old community, and I realize, and because very near from my family, and my family also work for community and with community. So, and we can go to shelter at night, and many health problem. So I think need not disaster relief in daytime, but need only nighttime, or even only nighttime. Yeah, so and I use the tradition in my house is become shelter because my home do and very traditional Japanese traditional living life that using well and stove, wood stove also, and Japanese traditional. And 100 years before in 100 years, my home is moved to the safe area because 100 years ago, at the time, very hard flood, the same area. So my house moved to the safe area. So my house become very safe shelter. And also another insight, I realized because Kurashiki City opened the data of shelter, the number of shelter, and we realized, they go back the back to Mabi town. Yeah, at first, by the response and rescue, they make the people, survivor, to move to safe shelter very, very far from their own hometown. So, but community people want to go back to their home to see how damaged. So, and this open data can let me know about the disaster survivor always moving. And so my traditional mapping method is old, I thought. So I make the map to make the map for survivors to move somewhere. So I make map, yeah, where is a safe toilet, where is a safe shelter, so that the survivor can go there. So, and using the Google Map and OpenStreetMap and combination, yeah, to adapt. Yeah, at first use the OpenStreetMap because the new and can distribute OpenStreetMap is very good. And then for navigation, Google Map is sometimes useful and sometimes not useful because the Google Map navigate is not counted about the disaster disaster damage. Then I realized that many survivors go stay in this place and stay in own house and not in shelter. And we have some this Yahoo mapping, Yahoo people flow mapping. After that, I can understand, yeah, people flow mapping understand mass gathering when where survivor go evacuate. And if calculate, nowadays, yeah, we can use smartphone people data, but nowadays people security also we have to how to manage the security and personal privacy also now challenge, I thought. And also we published this data. Yeah, if we know which shelter is occupied or not occupied, very, very uneasily we can calculate before if we use the open data. But and of course at the time of flood, not for the earthquake, we can use the data. In Japan, many evacuation map is for earthquake. So anyway, put the evacuation center, but at the time of flood, most of evacuation center in community is not available. So community people have to go away. Yeah, this kind of mindset change is required at the time. Anyway, through our work and this kind of not interdisciplinary collaboration, but transdisciplinary co-creation is very important, and youth leadership also very required, I thought, and because I collaborate with many students nowadays, and many have a good idea and innovative idea, but they have, and based on not only the DRR, but also how is safe, how well-being, not where is community, but who is community is very important, I thought now. Yeah, and so I really want to think about open governance and open data and global, not international exchange, but global learning, co-learning is very important. Yeah, my story is skipped, but as a result, I thought this kind of open governance mindset and co-creation mindset is very important, I thought, because I have an idea, because of survivor and with survivor, I can understand this kind of needs. So my research continuously, and now the global collaboration with not only DRR, but for community global civic pride or city promotion, we need this kind of global challenge. すいません。 required, I thought. So, ですね。はい。So also now, academia open governance also now promote. Thank you very much.
Thank you, everyone. Okay. Hi, my name is Diana Rango, as I was introduced. I work at the World Bank. I'm a senior gender specialist. I've been working on gender-based violence for 20 years, 2 decades. And it's so exciting to be here, and thank you for inviting me. I'm married to an electrical engineer, and he's never invited me to any of his conferences. So it's great to have an applied anthropologist being invited to share with you a little bit about our work and how it intersects with disaster risk management. So, let me start with telling you that 1 in 3 women worldwide experience some type of violence in their lifetime. And that can happen either at the hands of an intimate partner, or it can happen at the hands of a stranger, usually in the form of sexual violence. So the point here is that before a disaster occurs, women are experiencing violence. And so what happens when a disaster, in the onset of a disaster, is that that violence can be exacerbated because of the risk factors that increase, but also new forms of violence can appear in the communities that we're working with. We have data that shows, that displacement increases violence against women between 40 and 55% in countries like Colombia and Liberia. Not necessarily related to disasters, but displacement occurs and this violence increases. It not only increases in frequency, but it also increases in severity. And that's why we have to embed in both disaster preparedness, response, and recovery this knowledge that violence is occurring and that women will need help during and after a disaster. And so the good news is that we also have a lot of evidence that shows that data shows that violence against women and girls is preventable. And especially in disasters, there's several things that we can do. So today I want to talk to you about how the World Bank works with governments across low and middle income countries to help them prepare and understand the intersection between violence against women and girls and disasters. And to do this, we've created something called the Violence Against Women and Girls Resource Guide. And this resource guide is meant to be a very short resource guide that we can walk through with governments to help them understand the intersection between violence against women and girls and disasters. We know that several of those involved in disaster response and recovery and rebuilding efforts are not gender-based violence specialists, just like I'm not a civil engineer. And so what we want to do is work together with those at the front lines to have them understand what they can do to respond and prevent violence against women. So this brief that hopefully I can share with anyone that's interested has a few sections that are important. And again, we tried to keep it really short because this is just an introduction conversation that we have with governments. But the first thing is we highlight the key points, like the key points that I just made to you, that violence is happening before the disaster and it can happen during the disaster, and some different types of violence can happen during disasters based on close living quarters, based on the breakdown of social fabric, based on people losing their protection networks, based on police and first responders having to divert their attention to other things and leaving kind of a vacuum of police presence that could lead to more violence. So we highlight why the violence might increase, and then we hopefully through the resource guide show them what they can do to both prevent and respond. But before we get into what they can do, we talk about ethical and safety guidelines, because there's a lot of ethics and safety guidelines that have to be taken into account when talking to survivors. This is not something that you can go into a community, into a shelter, and ask freely about how many women are experiencing violence. There are several methodologies that we have to take into account when talking to potential survivors, so we don't do more harm and we don't introduce re-victimization into the lives of these survivors. So after we talk with them about ethics and safety, we teach them to do a rapid situational analysis. What might be those points where violence can increase? Do the latrines have locks? Are our shelters well lit? Are there spaces where women who might be experiencing intimate partner violence can be put away and far away from the potential perpetrator with blocking access to them? So some of those things we have in a really quick, rapid situational analysis that's part of the resource guide. And then we come into kind of the juicy part of the document, which are the areas of what we can do both before, during, and during the recovery of a disaster. And these are some examples of those interventions, but we split them up into 3 levels. We have policy level recommendations, we have activities that can be done at the institutional level, and then we have activities to include the voices of the community. So we always recommend that governments work on violence against women and girls using those 3 levels that are very important. So for example, here are some examples. Create protocols that recognize that violence against women increases, make sure that you're listening to the different voices of the community and reminding yourselves that women are diverse, right? That there's women with disabilities that might be at greater risk, that there's unaccompanied minors and children that might be at greater risk. So really listening to the community on where they see the risks happening before and after disaster. We also recognize that first responders are not GBV specialists, so we want to intentionally build the capacity of those on the front lines to be able to respond to gender-based violence. And one thing that's super important is to understand before a disaster who's already working on gender-based violence in the communities, because we want to include them in the aftermath of the disaster. Also might have experienced trauma, but that they're a resource in understanding how this community in particular has dealt with gender-based violence in the past and integrating their knowledge into the present response. So what we don't want to do is in the aftermath of a disaster have a bunch of UN agencies come in and create guidelines and protocols on how to respond to GBV that don't take into account any of the work that the local women's groups have done to respond to survivors of violence. And we always want to include working with community-based organizations, not just those who provide services, but that are well-versed with what women are experiencing in the community and that can inform us of those potential risks in the future. So this is another example of activities that we recommend after the onset of a disaster. Again, there's coordination mechanisms for gender-based violence that exist pre-disasters. We want to make sure that those involved in the recovery of a disaster integrate into those coordination mechanisms, recognize that they exist, instead of building parallel coordination mechanisms. We want to recognize that GBV expertise can be helpful, from designing shelters to informing those that are first responders on how to refer someone that shared that they've experienced violence to a trained service provider. There's a lot of work that can be done by integrating a GBV expert into the team of a disaster risk response group. We also have, there's already guidelines. UNHCR has come up with shelter guidelines, camp guidelines. There's a lot of resources on how to build women-friendly spaces after the disaster, so we want those to be integrated. Again, we don't expect those first responders to know about them, but if you integrate a GBV expert into your team, they'll know what those standards are and they can guide on those standards. There's other activities on distributing dignity kits and having outreach for women and girls is super important. So after a disaster, how can women and girls that are experiencing violence, how can they access support? Who can they go report to? And having this information distributed safely throughout the community. Recognizing that violence against women and girls doesn't only have physical consequences, it also has mental health consequences. So working with all of those who have the responsibility to provide both physical and mental health services and have them link up with survivors is very important. So the idea here is that the government should recognize that GBV, gender-based violence response and prevention in a disaster, requires a multi-sectoral response. So one of the things, and that everyone has a role to play, no matter what your profession is in this room, there is something that you can do. So the resource guide also has a table with very kind of punctual activities for those designing camps, for those first responders, for those providing health services, so they can see themselves reflected in this response to violence against women and girls. And those activities come with indicators, so we can always monitor and measure if what we're doing is being accomplished and what we hope to achieve to prevent and respond to violence against women and girls is being achieved. So really kind of our ask of governments is that they initiate conversation on how gender-based violence can be responded to in disaster risk management, in their preparedness activities. They innovate in what they integrate, and really that they intentionally invest and put resources and finances into building out the protocols, the standards needed for gender-based violence prevention and response after a disaster. Thank you so much.
Thank you, Diana. Okay, next we'd like to invite Lakman-san. Yeah, this is your presentation. Yeah, please.
Not me, right?
It's working.
Yeah. Okay, Bismillahirrahmanirrahim. Let me introduce myself. My name is Muhammad Lukmanul Hakim, so it is Arabic pronunciation, but I'm Indonesian. I'm work for Jasa Tirta One Public Corporation that as a state-owned company that formed by Indonesian government, who manage 5 river basins in Indonesia, which are Toba Asahan River Basin. It doesn't work? Yeah. Okay. Okay. So we manage 5 river basins in Indonesia, which are one Toba Asahan River Basin in North Sumatra, and then Serayu Bogonto, Ciratun Seluna, and Bengawan Solo River Basin in Central Java, and also Brantas River Basin in East Java. So these are our water resource management that we have done. So catchment areas management, river environmental management, water quality, and also water quantity management, water resource infrastructure management, also flood management. And then we provide raw water for energy and also for industry, for also domestic and municipal, and also we have water treatment plant, and we manage 7 tourism location and also environmental laboratory. So we have the concept for the disaster. So four aspects of the concept. First of all is intervention, which consists of instruction to behave, change, carry damage mitigation, and also emergency measures. And then the second one is emergency provision, which consists of emergency planning, training and exercise, and early warning and alert system. And the third one is event analysis. So we done the documentation of the event, evaluation on emergency planning, and strengthening of resilience. And the last one, we done the condition or recovery. So we done the construction and reconstruction, and also financing and prevention. So this is the concept that I talked before, that by utilizing existing data such as rainfall and prediction, historical and real-time hydrological condition, and then we provide information about flood discharge prediction analysis, predicted flood area and parameter warning alerts, and then the output of this data is early warning and emergency response. So this information will be used as a reference for the operational activities and submitted to stakeholders, local government, and also local communities by social media and also the website. And we also have a program for community empowerment. Three things that we have already done. First of all is education and training. So routinely address communities' activities regarding disasters and environmental sustainability. So conduct awareness campaigns about disaster risk and safety measures to be taken before, during, and after a disaster. And then for the community involvement, in Javanese language, we call it Jogo Tanggul, or guardian of the river dike. So we join with the local government and also local communities, the people who live around the river, so to guard the dike, and also empowering the former sign miners. And for the utilization of the technology, we have done early warning system to cover remote areas with support from the local community. So you can see the picture that this simple technology that it will be give a sign when the water level is increasing, so people know about the danger of the water level. And also we have a community involvement as a female community empowerment. We, especially in reforestation and conservation program. So we providing seeds, fertilizer, and other things where we collaborate with community, and so they can do the plantation, especially for the female. This program run in especially in Toba Regency, Samosir Regency, Humbang Hasundutan Regency, and North Tapanuli Regency. It's all in North Sumatra. This is the female involvement in our program, such as reforestation and conservation. And the case event, I shared the two events in last February. So in Saluna River flood event in Central Java. So the flood discharge in the Lucy River. Lucy River is one of the river in Saluna River. Was observed at Klambu Dam. Klambu Dam is infrastructure upper the Lucy River. We managed the Klambu Dam. It was 1,200 cubic meter per second, and it brings to the broken dike. So almost 3 regencies was flooded at the time. So this is the process of the disaster management. We provide kind of heavy machineries, and then in the community help us. They provide the manpower to give the emergency tag, something kind of like that. So the second one is Sadar and Brangkal Rivers Flood event. Sadar and Brangkal is the tributaries of Brantas River in East Java. So heavy rainfall conditions were observed from the Kalisadar automatic rainfall recorder. It was almost 175 millimeter, and then the discharge was about 950 cubic meter per second. So it also the deck is broken also, and then the residential areas is flooded as well. So Brangkal and Sadar is in Mojokerto city. So this is a process when we conduct the recovery of the event. So Mojokerto city has a female mayor, and she led the coordination between local government and local government and central government, and also National Disaster Agency, and also the state-owned company that involved in that area. So our contribution is construction of emergency decks, reparation of broken embankment, and support other instances for social countermeasure action to affected disaster victim. So this is the picture that the mayor that led to the coordination. It is also open the public kitchen, something like that, give the food for the refugees. So I think that also, unfortunately, disaster may happen to anybody, any age and any gender. So let's hold them together, no discrimination, with full understanding for more disaster resilient community. Thank you very much.
Yeah, thank you very much. Thank you for nice presentation. So we still have some time for discussion. First, I would like to open the floor. Any questions or comments do you have? Harafukusho, do you have any comments or questions? So yeah. So any comments or questions for presenters? Okay, so please consider your questions. For first, my question to panelists is, as the opening, Mr. Ban explained privacy issue at the evacuation shelter. But as Kambara-sensei showed, 30 years ago, we already experienced such a privacy issue in Kobe earthquake. But still, we are repeating. Recent Noto Peninsula earthquake, such a shelter management, is an issue, crucial issue. Why we are repeating such a similar problem, and how we can resolve? So, from one by one.
Because I'm never nurse or I'm citizen, so we observe. I can see everything, and I have insight and recognition already, and we understand what is the challenges now. But why we cannot make the solution or make the data for that? Yeah, and nowadays also another issue, communication. For communication, we can make my work many picture also. So, but nowadays the privacy issue and security also maybe many we have challenge more and more. So. Yeah, I think even though the anonymous, what is the challenges, and we should share about that. Yeah, and because we community in the community as an individual, I living on. So I wonder. Always, sometimes, often at the time of disaster, I thought they want to protect the data, or they want to protect the people. which is higher priority, I thought.
Thank you very much. So, not necessarily privacy issue, and not necessarily disaster, shelter issue. Yeah, if you have any view, please.
Yeah, no, thank you so much. I think in the aftermath of a disaster, there's so many pressing needs, and that's why I think that having planning prior to a disaster that recognizes why privacy and separate areas for women, for example, are at some point even life-saving efforts, right? That have to be integrated. And having that capacity building and understanding be kind of really embedded and taken on to those that are able to plan the shelters in the immediate aftermath of a disaster where there's so many pressing needs, but that it become on the top of their mind that one of those pressing needs is to keep, for example, women and girls safe, right? And so I think it's, we're still not there because we have to do a lot of transdisciplinary capacity building. So a civil engineer can tell me why it's important to have separate safe spaces for women, and that become part of their language and logic as well when they're imagining and constructing the shelters. I think this session is amazing to raise awareness. I'm really honored to be here, but I think we're at probably the starting point for those conversations. But it's great that they're starting. And with government, we really try to have this multi-sectoral kind of approach to these things around privacy and planning of shelters. And so hopefully we're on the road to doing this better.
Yeah, I guess if we talk about disaster, it's not about recovery, so it's also prevention, right? So I think the most important thing is coordination and also collaboration. The aspect of from local government, also communities, and also private sectors, which is private sector, pure private sector, or just state-owned enterprise, and also the central government that has the regulation for the kind of disasters. Because in Indonesia, you know, a lot of disasters happen, some kind of flood, and then landslide, and then you know, volcanic eruption. And so I think the most important thing is collaboration and coordination. Okay.
Thank you very much. Any other questions or comments do you have? 富野さん、お願いします。
Thank you to all the speakers today. My question is, so when we try to connect different stakeholders at the time of the disaster, it's usually too late or very challenging. So we always say we need to have these interdisciplinary relationship, collaboration before disaster happens. And I think those investments and activities are increasing. My question to you is it enough at the moment?
And I think actually now we have very good collaboration. Yeah, but the co-creation is much more important because but the challenge is sometimes I become a researcher and sometimes become collaborate with government officer and collaborate with business and I think that in fact, I feel the motivation, incentive motivation is very different, and planning duration is very different. Yeah, and researchers want to research what they want to research, And government people have already government plan, so they just follow the government plan and policy. And many stakeholder or want to use the money for the maybe donor also. So, but anyway, if they have same vision, they can collaborate and co-collaborate and work together, I thought. So, but no vision, or sometimes I think many, they want to do, I thought. And,
Yeah, thank you.
No, I mean, I think it's a starting point, but I think it has to be tied to financing for everyone's priorities, right? And sometimes in the aftermath of a disaster, we've done a great job of having these interagency coordination meetings, but then we fall back into our silos and we're like, but we need the money for the food. Who cares if the women have dignity kits to manage their menstrual hygiene needs, right? Because we're like, I'm the food person. And so I think we need intentional coordination, financing for everyone's priorities, so we don't fall in these traps of competing priorities, where I think that inter-institutional, multi-sectoral coordination can often fail.
Yeah, if you say that is it enough or no, I think it's never enough. It's never. So we should improve, right? So from this year to another year to next year, it will increase the programs and also the kind of fund to collect, you know. So I think it's never enough. So it can be improvement for all this.
Yeah, thank you very much. Any questions? Harashi.
Thank you for everything. I'm from city of Kurashiki City, belongs to the Okayama Prefecture, next to Hyogo Prefecture. I'd like to ask the one thing. Utilizing the positional information when the disaster happens, especially in your case, please give us some advice to utilize for an emergency action after a big disaster. Yes, especially I'm a civil engineer. I'm treating a GIS, so could you give me some advice?
yeah, because that I from the nurse perspective, because of this, the nursing insight is very important, and yeah, sometimes open data, existing open data, is not a very different map from after disaster recovery, a very different map. Yeah, and in nursing perspective, we have insight and already observe. So I want to plot our work. Yeah, so if, yeah, because at the time of disaster relief, I think the plan of disaster recovery plan or disaster relief plan, we sometimes that is an obstacle for us, because at first we always observe, and need that adaptive technology or demand-based innovation and solution is required. So if we want to follow the solution, not solution, but we have to follow the disaster recovery plan or disaster relief plan. We cannot do anything for community people, sometimes I feel. So if this kind of OODA loop, observation-oriented and decision-making and action, our work like this. So I want to our observation to survive people and for survive people and plot and utilize. I want to.
I'm gonna jump in with some of the ways that the community of violence against women and girls uses positional data, because we do. First, it's important to have a mapping of where services are before a disaster happens. And this means legal services, psychosocial services, health services, livelihood services, shelters for women that want to leave abusive relationships. If you have those data before a disaster, then hopefully you can update it after a disaster and still see which of those structures are still able to provide services and have the human resources and the capacity. So you're already able to quickly tell women which services that they know about are still available and which are not. And if you have new services, add them to the map in a real-time kind of data use. But I also think it's important for monitoring. If you provide the community access to a way to, through data, show you hotspots for violence, then you can take action and create something like lighting in a place where a lot of unwanted sexual abuse is happening because there's no light, and it's where the latrines are, and it's a simple fix of putting a light. So I think using information and the positional use of data superposed on maps is super helpful for identifying hotspots and where services are available for survivors.
Yeah, I said before that we use the information technology, so to proceed the data as kind of rainfall data, and also you can predict the flooded area, and it's spread by social media. So I think that's the answer for it.
Thank you. Okay, thank you very much. Almost time, and we have to move to lunch. Yeah, just pick up some keywords from discussion. So, yeah, for managing disaster, we may have some risk. We cannot cover, we may drop some important area like gender balanced, protecting vulnerable people or caring vulnerable people. So secondary, we need knowledge, and Diana said conversation is important, and awareness. Yeah, so in this area, transdisciplinary approach is quite important, how to communicate to people. And thirdly, yeah, I love some co-creation, conversation. So co-creation by multi-sector or multi-level governmental community, and community, of course, is the key. Lakman-san says, Jogotangal.
In Japanese language. It is
Japanese?
Guardian. Jogotangal is Japanese language. Japanese.
Java, not Japanese.
No, not Japan.
Confused. Okay. Yeah, and for such a co-creation, yeah, ICT definitely needed, such a mapping or some, ICT or GIS, etc. So this is another area for transdisciplinary approaches needed. Okay, thank you very much indeed. And as I agree with Diana, this is just starting, and we need some vision for all of us. We should create some vision that hopefully we can continue this discussion. Yeah, thank you very much indeed. Thank you.
Thank you.